Welcome to the Deep Dive. We take the sources you send us and really pull out the most interesting bits, the key takeaways.
Yeah, we sift through it all so you get the good stuff, those moments where it all clicks.
And today, we're jumping into something you might not expect, globophobia. It's the fear of balloons. You send over some really fascinating material on this specific phobia, and it kind of makes you stop and think, doesn't it?
It really does.
Like, how can a simple party decoration, something usually seen as fun, actually cause real intense anxiety for someone?
It's a perfect example of how varied human experiences, joy for one, real distress for another.
Exactly. So that's our mission for this deep dive. We're going to look at what globophobia actually is,
What triggers it?
right? The symptoms people feel, maybe where it comes from,
The causes, yeah, and how it's treated.
and diagnosis.
Yeah.
Plus, there's even a famous person who deals with this. Okay, let's dive in. First up, what exactly is globophobia?
Okay, so, put simply, globophobia is this persistent, pretty excessive fear of balloons. Sometimes people just call it balloon phobia. Makes sense. And the name itself, globophobia, it comes from Latin and Greek. Globus is Latin for sphere.
Right, like globe?
Exactly.
Right.
And phobos, that's Greek for fear. So, literally fear of spheres, basically, in this context.
Fear of spheres. Interesting how it breaks down. Okay, so most of us might jump a bit if a balloon pops unexpectedly, right?
Sure, it's startling.
But what specifically triggers that really intense phobic reaction in someone with globophobia? Is it just the pop?
Well, that loud bang, the popping
No.
sound, that's definitely the most common trigger we hear about, no doubt.
Mm-hmm.
But it's important to know it's often not the only thing. For some people, even just the texture of the
The
balloon,
texture, like the rubbery feel.
yeah, that rubbery feel, sometimes it has that powdery stuff on it, that can be really unsettling, cause anxiety.
Wow.
And get that, even the smell of the latex or rubber can be a big trigger for some individuals.
The smell. Really? I wouldn't have thought of that at all.
Yeah, it's not obvious, is it? So it can be a whole sensory thing that sets off the fear.
And that fear, I assume, leads to people trying really hard to avoid balloons.
Oh, absolutely. Avoidance is a huge part of it, a key characteristic, really.
Right.
People with globophobia might, refuse to touch balloons, obviously, but also just be near them.
So avoiding parties or celebrations sometimes.
Exactly. Or even certain shops. They'll go out of their way to steer clear because of that underlying fear that one might burst. It can really limit their social life, day-to-day stuff.
Yeah, you can see how that would happen. It really makes you appreciate how even a specific fear like this can really restrict things.
Yeah.
So when someone is triggered, what does that look like? What kind of symptoms are we talking about? It's more than just feeling a bit nervous, I guess.
Oh, definitely more. And yes, some symptoms are what you'd see with general anxiety, but they can be really intense with a phobia.
Like physically.
Physically, yes. You might see things like rapid breathing, maybe shallow breathing, heart racing, palpitations. Shaking, trembling, sweating is common, sometimes even chills.
Wow.
And then there's gastrointestinal stuff, nausea, sometimes vomiting, stomach pain, feeling dizzy, lightheaded.
Okay.
Difficulty swallowing can happen, or feeling like something's stuck in your throat. That pins and needles feeling, too.
That's quite a list already. It sounds like a full body reaction.
It really is. And it doesn't stop there. There are psychological symptoms, too.
Right. What kind of things?
Things like a dry or sticky mouth, feeling confused or disoriented, muscle tension, headaches, sometimes quite severe ones, and you might even notice changes in their face, like sudden flushing or becoming really pale, feeling extremely hot or cold suddenly, feeling really tired or fatigued, losing your appetite. It's a whole cluster of anxiety responses.
That paints a much clearer picture.
Yeah.
It's definitely not just, not liking balloons.
Yeah.
So how does a professional tell the difference between someone who just dislikes balloons and someone with diagnosable globophobia? What are the criteria?
Yeah, there are specific things clinicians look for. First, the fear or anxiety about balloons has to be intense and persistent. It needs to have been going on for at least 6 months.
6 months, okay.
And crucially, this fear leads to significant avoidance, like we talked about, going out of their way to avoid balloons.
Right.
And maybe the most important part is the fear, the anxiety, or the avoidance has to cause real distress or significantly interfere with their daily life, their job, their social life, their general functioning.
Ah, okay, so it's the impact on life that's key. That makes sense.
Yeah.
Avoiding birthday parties constantly or specific stores, like you said.
Exactly. That level of disruption is what elevates it from a simple dislike to a clinical phobia.
Got it. Okay, let's shift to causes.
Yeah.
Where does this fear actually come from? What are the roots?
Often, it seems to stem from negative or traumatic experiences linked to balloons.
Like a direct experience.
Yeah, it could be direct. Maybe a balloon popping really loudly right near them, especially when they were a child. That can be genuinely frightening for a kid.
I can imagine.
Or it could be indirect. Maybe a loud noise that sounded like a balloon pop happened during some other scary event, and the brain just made that connection.
Ah, an association.
Precisely. And it's interesting, a lot of people with globophobia trace it back to childhood incidents, which might explain why it seems, anecdotally at least, more common in kids. Those early experiences can really stick.
Yeah, that makes a lot of sense.
Yeah.
Are there other factors involved? Things that might make someone more likely to develop it?
Yes, definitely. There are several contributing factors that can sort of increase vulnerability.
Like what?
Well, people with sensory processing sensitivities,
Mm.
perhaps someone on the autism spectrum might just be naturally more sensitive to sudden loud noises like a pop, or even just the feel of the balloon.
Okay, that makes sense.
Also, having related phobias might play a role, like phonophobia, which is a fear of loud noises in general,
Ah, yeah.
or even chorophobia, the fear of clowns. Clowns often use balloons, right? So there can be overlap. And then there are broader factors. A history of anxiety or depression or panic attacks. Just being a generally more anxious or fearful person could predispose someone.
Right.
And finally, even just being under a lot of stress when a negative balloon-related event happens could make it more likely that a phobia develops. It's often not just one thing, but a combination.
So a mix of potential factors, experiences, sensitivities, maybe existing anxiety.
Right.
So if someone is really struggling with this, what help is available? What are the treatment options?
Good news is there are effective treatments. A major one is called response prevention therapy.
Okay.
It's a type of exposure therapy, and it's often quite successful for specific phobias like this.
Exposure therapy.
Yeah.
So facing the fear, how does that work with balloons? Sounds tricky.
It's done very gradually and carefully in a controlled, safe setting with a therapist.
Right.
So they might start really small, like the therapist just handles a deflated balloon while the person watches just to see it's not threatening.
Okay, step one.
Then maybe the person is encouraged to touch it, hold the deflated balloon, just getting comfortable with the object itself.
Slowly building up. What's next?
Then they'd start inflating it, but maybe just a tiny bit at first, gradually increasing the inflation over sessions.
Okay.
Once it's inflated enough that it could pop, the therapist might say, make squeaky noises by rubbing it. The person might start off sitting far away, and as they feel less anxious, they're encouraged to move closer, bit by bit.
I see. So it's all about gradual habituation.
Exactly. And the final stage often involves the therapist intentionally popping the balloon in that controlled way. Again, the person starts at a distance and moves closer as they feel able.
Wow.
The whole point is to demonstrate, through repeated safe exposure, that the sounds, the pop, while maybe startling, aren't actually dangerous. It rewires that fear response.
And you mentioned there was a case study in the sources about this.
Yes, quite a striking one. It involved a college student with a pretty severe fear. Before therapy, he'd actively avoid balloons, felt intense fear even just being like 4 feet away from one.
Okay.
The therapy described was quite intense. Over 3 days, he was put in situations where hundreds of balloons were popped at the same time.
Hundreds. Wow, that sounds extreme.
It does sound extreme. The researchers noted he initially tried to get away from the noise, but they didn't actually observe outward signs of, like, full-blown panic.
Interesting. And the outcome?
The outcome was significant. After those 3 days, the student reported he wasn't avoiding situations with balloons anymore, and crucially, the fear wasn't interfering with his life.
That's incredible. It really shows how effective that kind of structured exposure can be, even if it sounds daunting.
It's a powerful example, yeah.
Are there other types of exposure therapy used?
Yes, sometimes in vivo flooding is mentioned. It's another exposure technique, but generally more intense and less gradual. It involves immediate, prolonged exposure to the feared thing.
Right, so jumping more into the deep end, perhaps. Sounds like the approach depends on the person.
Very much so.
What about the thoughts? The fearful thoughts themselves? Is there therapy for that?
Absolutely. That's where cognitive behavioral therapy, CBT, comes in.
Yeah.
It's highly effective for phobias, too.
How does CBT work for globophobia?
CBT focuses on identifying those negative, often irrational thoughts and beliefs someone has about balloons. You know, if it pops, something terrible will happen. And then it helps the person challenge those thoughts, examine the evidence, and replace them with more realistic, less fearful perspectives. It targets the thinking patterns driving the fear.
So tackling it from both the behavioral angle, the exposure, and the cognitive angle, the thoughts.
Exactly, often used together.
Are there any other therapies mentioned?
Yes. Clinical hypnotherapy is sometimes used. It involves relaxation techniques to get into a hypnotic state,
Okay.
which can then be used to reduce anxiety and maybe reframe those negative thoughts or memories associated with balloons.
Interesting.
And also neuro-linguistic programming, NLP. One technique there involves teaching the person to kind of view themselves and their fear as if they were an outside observer, a third party.
Ah, to create some distance.
Yeah. The idea is to detach emotionally a bit, lessen the distress.
So quite a few psychological tools in the toolbox.
Mm-hmm.
What about medication? Does that play a role?
It can sometimes. Medications aren't usually the primary treatment for specific phobias, but they can help manage the severe anxiety symptoms.
Like what kind of meds?
Things like beta blockers can help control physical symptoms like a racing heart or shaking.
Okay.
SSRIs, which are common antidepressants, are also used for anxiety. And sometimes sedatives or other anti-anxiety drugs might be prescribed for short-term relief in very specific, unavoidable situations.
But therapy is really the main focus for long-term change.
Generally, yes. Medication helps manage symptoms, but therapy, especially exposure therapy and CBT, aims to address the root cause of the fear itself.
Got it. Now, earlier we touched on the diagnosis. You said globophobia isn't listed as its own specific thing in the DSM-5, the big diagnostic manual. How does that work then? How do people get diagnosed?
Right. So while globophobia isn't its own separate entry, mental health professionals diagnose it under the umbrella category of specific phobia.
Huh.
That category covers any intense, persistent fear of a specific object or situation like flying, heights, animals, or in this case, balloons that causes significant distress or life impairment.
So a clinician assesses the person's fear of balloons against the general criteria for any specific phobia.
Exactly. If the fear meets those criteria, persistent, excessive, causes avoidance, interferes with life, then they get a diagnosis of specific phobia, with balloons being the specified fear.
That clarifies things. It fits into that broader framework. Okay, and finally, the sources mention someone famous who has globophobia.
That's right. Oprah Winfrey has spoken about having globophobia.
Oprah.
Mm-hmm. And I think it's a useful reminder, phobias can affect anyone, regardless of how successful or, put together they might seem externally. These fears are real and can be quite impactful.
That definitely drives the point home. It's not about weakness or anything like that.
Yeah.
Okay, so let's try and wrap this up. We've dived into globophobia, the fear of balloons.
Defined it, looked at the triggers, not just the pop, but texture, smell.
Right, covered the pretty wide range of symptoms, physical and psychological.
Talked about potential causes, often rooted in childhood experiences, but also linked to other factors.
And explored the treatments, especially exposure therapy, like response prevention, CBT, other therapies, and sometimes medication for symptoms.
And how it's diagnosed under that specific phobia category.
It really is quite something, isn't it?
Yeah.
How a specific fear like this can genuinely shape someone's life, leading to avoidance and real anxiety.
Absolutely. It highlights how personal and varied our fears can be.
Which leads to a final thought, maybe. It makes you wonder what other common, everyday things might hold these hidden anxieties for people we know. Things we wouldn't even think twice about.
That's a really interesting question to ponder. This whole exploration shows there's often a path to understanding and treating even fears that seem maybe irrational from the outside. What other fears might have similar paths waiting to be understood?
Great point. Well, thank you for walking us through all that really fascinating stuff from the sources provided.
My pleasure. Thanks for having me.
And thank you for listening and for sending in your source materials. If you've got a topic you're curious about and some sources you want us to tackle, send them over. We're always ready for the next deep dive.